Welcome to the lesson 5 of the Planetary Health Green Skills for Nurses course by EFN. In this comprehensive lesson, we will dive deeper into providing guidance and support on environmental health risk, a critical aspect of nursing in the context of planetary health. This lesson strongly aligns with core competency 5, which emphasizes the ability to independently offer advice, instruction, and support to individuals in need of care and their caregivers. As a nurse, it's crucial to develop the capacity to provide precise guidance to your patients regarding their environmental health risk. It's paramount to recognize the enormous burden of preventable ill health that our society carries. Addressing the root causes of illness and prioritizing disease prevention isn't just an ethical imperative, but also makes economic and planetary health sense. This prevention strategy has two facets. First, eliminating environmental risk, and second, safeguarding patients from existing risk, often referred to as adaptation or resilience. This lesson will primarily focus on the latter, protecting patients from existing environmental health risk, while considering both environmental and social determinants of health and placing emphasis on identifying and assisting vulnerable populations and patients. Vulnerability to environmental risk varies among different populations. According to findings from the European Environmental Authority, individuals with a lower socioeconomic status tend to be more affected by air, water, and noise pollution, as well as climate change. This is a result of the complex interplay between poverty, social disparities, and environmental factors contributing to ill health. Vulnerable groups encompass children, pregnant women, and the elderly, who are particularly sensitive to poor air quality, pollution, noise, and extreme temperature, both cold and heat. Moreover, pre-existing medical conditions can be exacerbated by these environmental factors, compounding the health risk. In the realm of planetary health, it's imperative to adopt a systemic view and contemplate the ethics of planetary health, which entails recognizing and addressing the inequities that lead to poor health. These inequities exist within countries, between countries, and among different regions of the world. While some regions, such as the EU, consume substantial resources and contribute significantly to global pollution, unsustainable consumption, and climate change, other regions bear the brunt of environmental changes and their health impacts. One of the most significant environmental health risks in the EU is the air pollution. In the year 2020, nearly 3,100 premature deaths were attributed to chronic exposure to fine particulate matter. Chronic exposure to nitrogen and acute exposure to ozone led to additional premature deaths. Air pollution stems from various sources, including heating and cooking, tobacco smoke, combustion from transportation, power generation and industry, agriculture, and wildfires. The World Health Organization categorizes air pollution in two main types: the household air pollution, which relates to indoor air quality, and the ambient air pollution, concerning the quality of outdoor air. While the health effects of some air pollutants, like fine particulate matter, nitrogen, or ozone, are well documented, there are emerging concerns about certain air pollutants for which we haven't yet quantified the health effects. These include heavy metals, which are developmental neurotoxins, new neonicotinoids, glyphosates, and pharmaceutical waste. As a nurse, you can play a pivotal role in helping your especially vulnerable patients improve their indoor air quality. For instance, assisting them and their families in smoking cessation can significantly enhance indoor air quality. Additionally, you can offer guidance on outdoor air pollution and ways to protect themselves. An invaluable tool for this purpose is the European Air Quality Index, which provides real-time information on air quality in your patient's localities. To deepen your understanding of air quality, its health impacts, and the strategies for safeguarding your patients, you can explore a World Health Organization course linked in the additional resources. Environmental changes, such as rising temperature and the spread of invasive species like ragweed, have the potential to increase airborne allergens, notably pollen. The maps displayed on this slide illustrate the percentage of the population sensitized to pollen. The future scenario depicted on the right assumes only moderate greenhouse gas emissions, implying a reduction in emissions. However, with increasing temperature, the pollen season will shift and extend, altering pollen concentration and allergenicity, as well as shifting the geographical distribution of pollen. This means that alongside the rising air pollution, allergies due to airborne allergens are likely to surge in the future. Another significant environmental health factor is the heat waves. Due to climate change, which we will explore in detail in the lesson 8, the frequency and the duration of the heat waves in Europe are on the rise. One of the most deadly heat waves in the recent memory was the 2003 European heat wave, which claimed over 70,000 lives, with vulnerable individuals such as the elderly and the outdoor laborers being the hardest hit. As a nurse, you can make a substantial difference by helping especially vulnerable patients prepare for heat waves and adapt to the challenges they present. Such measures can truly be life-saving. Heat waves can also coincide with droughts, introducing additional health challenges related to nutrition, mental health, airborne and dust-related disease, wildfires, property and livelihood losses, and more. It's worth investigating whether your hospital and your country has established heat wave action plans to safeguard your patients during such events. Finally, an environmental risk worth considering is the increased incidence of infectious diseases transmitted by vectors. Environmental changes, such as climate change and biodiversity loss, have enabled vectors to expand into new regions or increase in number. For instance, malaria incidence has risen in the eastern Mediterranean region. Ticks that transmit Lyme disease and tick-borne encephalitis are now moving farther north in the EU. altering the environmental risk landscape for your patients. Other environmental changes, like fluctuations in ambient temperature, can also influence the prevalence of food and waterborne illness, such as salmonellosis. In conclusion, this lesson prompts you to reflect on the environmental risk your patients might face and whether you are equipped to advise and protect them. In the next lecture, we will explore more ways the environment can influence your patient's health. All the changes we have discussed in these lessons are long-term or slow-changing risk. In the lesson 6, we will delve into disasters and crises.